Okay, greetings, good day to you all. Uh, Let me introduce myself. My name is Dr. Ronald Pratama. I'm my field of studies tropical medicine science and also the public health. I am a medical lecturer at the Department of Public Health, Hang Tuah University Faculty of Medicine. Today we are gonna discuss about measures in epidemiology. I'm sharing a lecture about measures in epidemiology in terms of morbidity and mortality. For the disclaimer, in this lecture, I would like to switch between English and Indonesian language since what I had in mind when preparing this lecture is to give understanding, comprehension to especially to my students, my medical students in learning about this particular topic. Okay, we continue. Why is it important to study about this topic? Mengapa ini penting mempelajarinya? Understanding epidemiological measures of morbidity and mortality is crucial for the first is tracking disease patterns, then identifying at-risk populations, and planning public health intervention. Jadi ada tiga ya, kepentingan intinya melacak pola penyakit atau masalah kesehatan, melakukan identifikasi populasi yang berisiko, dan merencanakan intervensi kesehatan masyarakat yang sesuai. Ya, jadi begitu. And these measures provide insights into the health of communities, guiding healthcare strategies to improve overall well-being and reduce the burden of diseases. Ya, jadi dengan mengetahui pengukuran-pengukuran ini, diharapkan itu akan memberikan masukan yang berharga mengenai kesehatan masyarakat, memandu upaya-upaya untuk pelayanan kesehatan, strateginya untuk pemecahan masalahnya bagaimana, serta untuk meningkatkan secara umum keadaan kesehatan masyarakat dengan baik dan tak kalah penting adalah menurunkan beban dari penyakit atau masalah kesehatan tersebut. Okay, next, we are gonna talk at the first part of this lectures. We are gonna talk about morbidity numbers atau angka-angka kesakitan. Ya, mungkin kurang pas ya. Angka-angka yang menggambarkan tentang beban penyakit. Ya, itu pas ya. Burden of disease. Okay, we are talking about the first. The indicator is prevalence. So what is prevalence? Here we can see the prevalence is the total number of cases of a disease in a population at a specific times. The keyword is the total number. Total, yeah. So all of the cases. Yeah. Here is the formula. Prevalence, number of existing cases divided by total population and multiply by 1000. Yeah, so this is the formula, right? Okay. So I will provide one scenario to give a comprehension about the formula. Yeah. In a town of 10,000 people, 500 currently have diabetes. So what is the prevalence of the diabetes? We can see from the formula, the numerator is the 500 divided by 10,000 people, the total population, and multiply by 1,000. So, okay. So the result is 50 per 1,000. Okay. Yeah. Okay. This is one example of the calculation, right? Okay. What is the importance of calculating the prevalence? It helps assess the overall disease burden in a population. Ya. Itu membantu untuk mengevaluasi, melakukan penilaian tentang beban dari penyakit, ya, beban dari penyakit pada populasi. Okay. Next, we're talking about incidence. Yeah. Incidence is the rate of new cases in a population over a specific time period. The key words is new cases, ya, kasus baru. Here's the formula, right? Okay. The formula for incidence: number of new cases divided by total population, then multiply by 1,000. Here is one scenario. In a year, 50 new cases of flu develop in a city with a population of 100,000. So, how do we calculate the incidence? So, using the formula, we conclude that the incidence of flu in the population is 0.5 per 1,000. Ya, 0,5 setiap 1,000 penduduk. So, what is the importance of calculating incidence? It helps understand the risk and spread of the disease. Yeah, okay. And then we move on for the next morbidity numbers, the reproduction number, or we can call it the R0 or R0. R0 or R0. What is this? This particular indicator represents the average number of secondary cases produced by one infected person in a susceptible population. Jadi bilangan reproduksi ini memberikan gambaran tentang rata-rata dari jumlah orang yang tertular, ya, kasus sekunder orang yang tertular dari satu orang sumber penularan pada populasi yang rentan. Ya, jadi keywordnya adalah populasi yang rentan, ya. Itu. Populasi yang rentan itu kalau kita bicara itu bagaimana? What's the meaning of a susceptible population? Susceptible population means the group of the population that in the case of the uninfectious disease, the group of the population where the people still don't have immunity, belum memiliki kekebalan for the disease, ya, belum memiliki kekebalan terhadap penyakit tersebut. Okay. Here's the formula for R0. The numerator is the average number of secondary cases divided by average number of primary cases. Yeah. Here's the scenario. If one person with COVID-19 infects, on average, 2 other people, yeah, what's the reproduction number? So, based on this information, we conclude the R0 or the reproduction number is 2. Since one person with COVID-19 on average infects 2 other people. What's the importance of knowing this particular number? It provides insights into the potential for disease spread. When the R0 of a disease is quite high, like for an example, measles, it has approximately R0 of 12 to 20, in some cases 25 or more. This means the disease is very contagious. Penyakit itu sangat menular. Sehingga, so the efforts to contain the spreading must be emphasized. Upaya-upaya untuk menekan penularannya harus lebih diberikan perhatian. But the reproduction number is dynamic. Dynamic means there are some factors influencing the reproduction number. Yeah. So the nature of the disease. Yeah. The nature of the disease, when the disease is transmitted by, let's say, airborne, they are not tend to be quite high compared to when the disease is transmitted via, let's say, cutaneous. Yeah. Since the transmission is quite slower, yeah, or maybe bloodborne transmission. Since the transmission is quite slower than airborne. The other factor influencing the reproduction numbers is the immunity of the population. Yeah. When the population is highly vaccinated, yeah, the vaccination is successful, so lots of people are immune to the disease. This will somehow influence the reproduction number. So the reproduction number is not what can I say? It's not set in stone. Yeah, it will only give us some description. I mean, it will give us some picture about how contagious the disease is, but there are factors influencing the transmission of the disease. Okay, we move on. Next, morbidity numbers is attack rate. Attack rate is the proportion of people at risk who develop the disease during an outbreak. Okay, let's see. The formula is for the numerator, number of new cases divided by total at-risk population multiplied by 1,000. So the attack rate from this definition and the formula, we can conclude that the attack rate is used when there is an outbreak situation, or we call it in Indonesian language, kejadian luar biasa. Yeah. When the disease numbers increasing rapidly compared to the usual pattern of the disease, yeah, like say the numbers of cases increase 2 times, yeah, compared to last month. So we can say that there is an outbreak going on, like that. Okay, one scenario to this number. In a foodborne outbreak, 30 out of 200 people who ate a contaminated dish, they become ill. How to calculate the attack rate? So from this information, 30 divided by 200 multiplied by 1000, we get the number 150 per 1000. Okay, that's how we calculate this. What's the importance of calculating attack rate? It helps assess the risk within an exposed population. Ya, risikonya, menilai risiko tertularnya penyakit atau risiko terjangkitnya suatu penyakit pada populasi yang terpapar. Dalam hal ini adalah dalam kasus kejadian luar biasa. In the case of an outbreak. Okay, moving on. Secondary attack rate. By definition, it measures the risk of contracting a disease among close contacts of a confirmed case. Yeah. The formula is number of secondary cases, hence the word secondary. Number of secondary cases divided by number of exposed individuals multiplied by 100. Okay. Jadi, we give a scenario. In a measles outbreak, okay, now the disease is measles, right? It is quite appropriate since this particular infectious disease is highly contagious, very, very infectious, very easy to transmit from one person to another person. In a measles outbreak, 20 out of 100 unvaccinated children exposed to a measles patient contract the disease. So what is the secondary attack rate? We can calculate it, and we find the secondary attack rates is 20%. What's the importance of calculating secondary attack rate? It helps evaluate the contagiousness and transmissions. Seberapa penularannya, seberapa menular suatu penyakit itu, dan bagaimana penularannya pada population at risk. Okay, move on. For the next morbidity numbers, age-specific morbidity rate. It breaks down the morbidity rate by specific age groups within a population. Ya. Ini menjelaskan bagaimana laju. In Indonesian language, rate is laju. Ya. Laju morbiditas pada kelompok umur yang spesifik. Okay. Here's the formula, right? You can see number of cases in specific age groups divided by total population in specific age groups times 1000. Yeah, multiplied by 1000. Here's the scenario. In a city, the morbidity rate for the under 5 years old age group is 15 cases per 1000 children. It's under 5 years old. Yeah. So, hence the age-specific morbidity rate is 15 cases, 15 per 1000. What is the importance? The importance is to reduce age-related risk factors and healthcare needs. So, in this scenario, for example, why the age-specific morbidity rate in this particular age group is 15 compared to the adult? Yeah, in adult there is like uh, only two cases, uh, morbidity rate, only 2 cases per 1000 of adults. Yeah. Are there any specific risk factors unique to this particular age group compared to the adult age group? From then on, the researchers, the epidemiologists will learn, will uh, collect more data, more informations to understand the risk factors unique to the age group, and then can tailor the appropriate interventions. Okay, we move on. This is the last morbidity numbers. There are, from what I understand, there are still more, but for this particular lectures, I will limit until this number, years of potential life loss. Perhaps more informations I will give the reference at the end of this lecture. Okay. Now we are talking about years of potential life loss. It measures the impact of premature death on the population, typically related to chronic diseases. This talking about deaths, but we group in the morbidity numbers, yeah, to give a comprehension, to give an idea about the impact of a premature death on the population. Yeah. The formula is years of life expectancy minus age at death. Yeah. The scenario: if a person dies of a heart attack at age 50, their life expectancy was 80 years. How do we calculate the years of life? How do we calculate the years of potential life loss? Simply, we uh, subtract the 50 from the 80, and we find 30 years. What's the importance? It reflects the societal impact of early deaths. Yeah, that's very, very simple, right? Okay. Now, for the continuation, the second part, we're talking about mortality numbers, measures of epidemiology and mortality numbers. There are some indicators of this particular topic. In my lecture, I will limit about 6 indicators. What are they? The first is crude death rate, or CDR for the abbreviation. The definition is the total number of deaths in a population over a specific time period. Jumlah total kematian dalam populasi dalam kurun waktu tertentu. The formula for the crude death rate: the numerator is number of deaths divided by total population in the specific time period, multiply by 1000. I will give an example. In a town with 10,000 residents here, 40 deaths occur in a year. So what is the crude death rate? The crude death rate can calculate, and we find the results is 4 per 1000. The importance: it provides general overview of mortality within a population. It is very straightforward, right? Memberikan gambaran secara umum tentang kematian, jumlah kematiannya ya dalam suatu populasi. I continue. CFR, case fatality rate. The proportion of deaths due to a specific disease among confirmed cases. Pay attention, the keywords. Due to a specific disease among confirmed cases. Ya. Jadi, proporsi dari kematian karena penyebab khusus karena suatu penyakit ya dari kasus-kasus yang terkonfirmasi. The formula: number of deaths from disease divided by number of confirmed cases multiplied by 100. Okay. Scenario: in a COVID-19 outbreak, there are 100 confirmed cases and 5 deaths. Okay. So how do we calculate the case fatality rate? We can calculate by 5 divided by 100 multiplied by 100 in percentage. So the result is 5. The case fatality rate is 5%. What's the importance? It helps assess the severity of a disease. The severity of a disease. How severe, how fatal is a disease. Seberapa mematikan sih penyakit itu. Hence, if the case fatality rate is high, we can conclude that that particular disease is fatal, is severe. Okay, continue. Next is maternal mortality ratio, or MMR. Right? Yeah, is the number of maternal deaths per 100,000 live births in a specific time period. What are the keywords? Keywords: maternal deaths. Yeah, pay attention. Maternal deaths. Yeah. The word maternal, we will come back later about this word. Per 100,000 live births. So the denominator is a live births, kelahiran hidup, in a specific time period. The formula: number of maternal deaths divided by number of live births multiplied by 100,000. Okay. I will give a scenario. In a year, there are 10 maternal deaths and 20,000 live births. So, how do we calculate the MMR? We just input the numbers into the formula, and with a constant number of 100,000, we find the result is 50 per 100,000 live births. Why is it important? Because maternal mortality ratio measures maternal health and the quality of healthcare during childbirth. It also gives a picture, an idea about the quality of the healthcare of a place, of country. Yeah. So if the maternal mortality ratio is like this, 50 per 100,000, is quite high. It's very high. Yeah. Okay. Then about infant mortality rate. Yeah. The number of deaths of infants under 1 year of age per 1,000 live births in a given year. The keywords are under 1 year of age, yeah, and 1,000 live births. So the constant number is 1,000. Yeah. Here is the formula. Okay. And for an examples, in a year there are 5 infant deaths and 2,000 live births. So we can calculate, and we find the infant mortality rate is 2.5 per 1,000 live births, right? Yeah. What is the importance? The importance, it indicates the overall health and access to healthcare for infants in the region. Jadi ini memberikan gambaran bagaimana sih kesehatannya secara umum, ya, bayi, dan bagaimana kualitas layanan kesehatannya. Okay. I'll continue. age-specific mortality rate, like ASMR. Yeah, what a pun. Yeah, what a pun. Yeah, like ASMR. That's another very different topic. Yeah, but this is age-specific mortality rate. Indicates the mortality rate within specific age groups in a population. Ya, memberikan gambaran tentang laju kematian dalam satu kelompok umur yang khusus, yang spesifik dalam populasi. Ya, the formula: number of deaths in specific age group divided by total population in specific age group multiplied by 1,000. Scenario: in a country, the mortality rate for the 65 until 74 years old age group is 50 deaths per 1,000 people. Okay. The importance: it helps target age-specific healthcare interventions. Okay, yeah. I continue. Now, there is also standardized mortality ratio, or SMR. It compares the observed number of deaths to the expected number in a standardized population. Yeah. The keywords are observed number and expected number. Okay, right? So it's very straightforward. The scenario, we can input the number to the formula and we find the SMR is 150. What's the importance? It allows for comparisons between population with different age structures. Yeah. So, like say, for comparison, untuk perbandingan dalam populasi itu dengan beberapa struktur usia yang berbeda, kelompok usia yang berbeda-beda, seperti itu ya. Okay. Now there are, after what I explained before about the morbidity and mortality numbers, I will show you some assignments, yeah, but it's more like for self-assessment, yeah. But in this lecture, I will try to explain some of the questions. Then maybe for the other question, you can try to work on it yourself based on the informations from the previous slides. Okay. For the question 1, let's say the scenario: in a small town, a measles outbreak occurs. Discuss the concept of the secondary attack rate and explain how it can help epidemiologists in understanding the transmission dynamics of measles. Please provide a hypothetical SAR calculation based on the scenario. Okay, let's say, for instance, if 20 out of 100 unvaccinated children exposed to a measles patient contract the disease, the secondary attack rate would be 20%. Yeah. So what if the number of secondary attack rate is quite high? A high secondary attack rate indicates a highly contagious disease, emphasizing the importance of vaccination and control measures. Ya. Jadi kalau contohnya 20 anak itu ketularan ya, dari 20 anak dari yang 100 anak itu belum mendapatkan vaksin campak, ya. Tertular campak, menjadi sakit campak ya. Maka secondary attack rate-nya adalah tadi 20 ya, 20%. Ini angkanya tinggi, sehingga ya ini menunjukkan suatu penyakit yang sangat menular dan diperlukan upaya-upaya bagaimana untuk menanggulanginya. Diberikan vaksinasi dan upaya-upaya pengendaliannya. Misalkan penularannya kan the measles transmission by droplet. Yeah. So how to contain? Yeah, using face mask. Yeah. And isolate the patient so that he or she cannot transmit the disease to other people. Right? Okay. Next. In a city, the age-specific morbidity rate for the 0 to 5 age, under 5 years old group, is 15 cases per 1,000 children. Explain the concept of age-specific morbidity rates and their significance in epidemiology. Then discuss why this information is valuable for public health planning. Okay. So yeah, like what I explained earlier, if the age-specific morbidity rate 15 for the under 5 years old, then compared to adult, like say only two cases per 1,000. Yeah. So the under 5 years old age group has a higher morbidity rate, yeah, suggesting a need for targeted healthcare services such as vaccinations to protect young children from disease. Okay. And yeah, okay, this was standard. Please try to work on it yourself. I will give some times for you to read and to write the question. Okay. Then for this, accrued death rate. Okay. And last, maternal mortality ratio. Yeah. This is what I want to emphasize. Yeah. Discuss the concept of MMR and explain why some deaths that occur during pregnancy are not counted as maternal deaths. Provide examples to illustrate cases that are not considered maternal deaths. Like say, for instance, deaths due to accidents, motor car, automobile accidents, unrelated illnesses, like say coronary heart disease, yeah, or violence, are typically not classified as maternal deaths, yeah, even if they occur during pregnancy. Yeah. Why? This is because they are not directly tied to maternity. Yeah. To be considered a maternal death, there must be a direct obstetric cause, such as complications during childbirth or pregnancy-related conditions. In Indonesian language, jadi kalau misalkan penyebab kematiannya itu ya kecelakaan lalu lintas, ya, atau karena penyakit jantung koroner, misalkan gitu ya, atau karena kekerasan rumah tangga, gitu. Ya, contoh-contohnya tadi ya. Ini tidak dihitung sebagai angka kematian ibu atau maternal mortality rate. Kenapa? Karena penyebabnya bukan karena penyebab langsung terkait dengan uh, kehamilannya, ya. Gitu. Contoh penyebab langsung kehamilannya apa? Misalkan kasus-kasus ini preeklamsi, ya, atau kasus-kasus perdarahan pasca persalinan, ya, itu postpartum hemorrhagic, nah itu baru. Those are counted as obstetric-related maternal deaths. Yeah, okay. Why we exclude the non-maternal deaths from our calculations? Because it ensures that the measures accurately reflects the risks and challenges specifically associated with maternity. Ya, jadi bisa dihitung dengan benar ya, terkait dengan kehamilannya seperti itu. It helps public health authorities focus on intervention to improve maternal health and reduce mortality related to pregnancy, which is critical for the well-being of women and infants. Ya, jadi kalau input datanya tepat, kasus yang dihitung itu tepat per definisinya, itu bisa memberikan gambaran pada epidemiologis, ya, ahli kesehatan masyarakat untuk memberikan intervensi yang sesuai. Seperti itu, ya, just like that. Here is the references. I take from the Center of Disease Prevention and Control, and from the Modern Epidemiology by Rothman, Greenland and Nash. Okay. And I think this is the last. As we conclude, remember that these numbers often intertwine. Yeah, like these numbers are correlated one another. Yeah. So we must interpret them judiciously, carefully. Yeah, because numbers don't deceive, but interpretations can. Yeah, numbers don't lie, but people do. Yeah, so be careful. And lastly, feel free to use the materials in this lecture, but kindly cite me as the original author. Your feedback is invaluable, and I'm grateful for your attention on this epidemiological journey. Thank you for being part of this lecture. Uh, God bless.